Wonderful. Thank you very much. So I will be presenting on housing opportunities for people with HIV/AIDS, also known as Hopwa. And again, my name is Patrick Stonehouse. I use he, him, his. I'm the Director of Program Operations for the Community Health Services Division of the Syndemic Infectious Diseases Bureau. And I'll go over what some of that stuff means in a moment. So first, a quick description of the housing opportunities for people with HIV or AIDS, also known as Hopwa. This is a housing first model, meaning that the idea of we provide housing to individuals prior to or so that we can better address any behavioral or social issues that the individual is experiencing. The stability of the housing that is provided thereby allows for the individual to have a greater access and benefit to other services and supports that exist for them. This is specifically for people with HIV and their households. There are a range of housing models that will be split across two different requests for proposals that will be coming out. And Hopwa for this jurisdiction covers the Chicago eligible metropolitan statistical area, which includes Cook County, DuPage County, Grundy, Kendall, McHenry, and Will County. And the Hopwa is a part of a continuum of services for people with and as well as individuals vulnerable to syndemic infectious diseases. And I'm speaking of it in these ways. The RFPs for Hopwa programs are not quite ready. They're under review, internal review for release soon. And so some of the specific details that were, for example, the Mayor's Office of People with Disabilities went over, those are still being worked through for ours. We will be holding a more formal bidders conference when our RFP is ready to come out, but we're not quite there yet. So the Syndemic Infectious Diseases Bureau is made up of a series of different divisions. There's Public Health Services, which is collection of activities that we as staff for the Chicago Department of Public Health conduct ourselves, STI Clinical Services, Tuberculosis Clinical Services, Research Strategy and Development, which is largely looking at organizational development, both internally as well as for delegate agencies, project sponsors, and other organizations we partner with, Finance and Administration, and the Community Health Services Division, which is the division the Hopwa program resides within, which is a lot of our external activities. This is where a lot of our funding goes out to delegate agencies and project sponsors to conduct and implement services. This also involves marketing, communications, community planning, overall change strategy, and a lot of community engagement activities. So for the Syndemic Infectious Disease Bureau, which the Syndemic Infectious Disease is an old term that's come into focus relatively recently, and different jurisdictions define syndemic infectious disease in different ways. But for the Chicago Department of Public Health, we're talking about tuberculosis, Mpox, viral hepatitis, sexually transmitted infections, HIV, and any kind of co-occurring social or health concerns. So as other areas, experiences of health concern exist or come up amongst our priority populations or community areas we're focusing our energies on, we may very well shift over or incorporate those areas of concern into our functioning, into our activities, but it's not necessarily something that we built ourselves around. A good example of this would actually be Mpox. When the Mpox outbreaks of 2022 started, because it was primarily impacting individuals who identify as members or who don't identify, but who are members of LGBTQ plus populations or are gay, bisexual, or other same gender loving men, which are populations that we're focusing our energies on, we, in partnership with other parts of the department, incorporated Mpox work into it. And should another occurrence happen, we would do similar. Collection of activities within each of those areas. So for tuberculosis, we do a lot of follow-up and support for individuals who have been diagnosed with TB, so a lot of directly observed therapy. Mpox, we do prevention, messaging, vaccination, screening, and linkage to treatment. Viral hepatitis, prevention, messaging, screening, and follow-up for individuals. Sexually transmitted infections, a lot of prevention messaging, some prevention treatment, which is doxy pre-exposure prophylaxis, which allows an individual to be exposed to a sexually transmitted infection, but able to fight it off through medical assistance. Screening and treatment. And then for HIV, we do, again, a lot of messaging, prevention through pre-exposure prophylaxis, post-exposure prophylaxis, and condoms. For those of you who do not know, pre-exposure prophylaxis and post-exposure prophylaxis are medications that an individual can take either before or immediately after potential exposure to HIV, which would prevent them or very strongly aid in their ability to fight off the infection and therefore not acquire HIV. We do support a lot of care for persons with HIV and supportive services, housing, which is the focus of these specific RFPs, and a lot of follow-up with individuals who have HIV to ensure that they're getting all of the support services and clinical care that they need. And this is sort of the portfolio of services, the way we conceptualize HIV services. So the idea being that an individual is initially screened for HIV, they are either identified as a person with HIV or a person vulnerable to HIV. And in any case, we and our delegate agencies and community partners go through a series of steps to try to support that individual in accessing and benefiting from clinical care. There are a lot of support services that go along with that and a lot of clinical services that go along with that. And wrapping around all of these clinical and supportive services are a collection of other activities that we participate in and we support. There's marketing, so getting information out about HIV, about services that are available, about innovations in technology and treatment. There's resource coordination, which is basically just making sure that individuals are aware of all of the services and supports that exist. So you can reach out to, there's an organization or a program called the HIV STI Resource Hub. People can call in or access online that allows them to find out basically what is it that you're looking for, and we will do our best to try to find it for you. Community development, which is looking at systemic and structural intervention. So the idea that with all of the clinical and supportive services of the highest quality that could be provided, there are still some individuals, communities, geographies, populations for whom that isn't sufficient because there are systemic and structural barriers that get in the way. Things like systemic racism, homophobia, transphobia, community violence, misogyny, and considerably more. And then lastly, surrounding all of these is housing as a fundamental human right that we endeavor to, through our delegate agencies and partners, to provide for persons who are vulnerable to HIV, as well as people with HIV, so that they are able to be in a stable environment from which they can best access and benefit from the clinical and supportive services that exist. Now to Hopwa programming. So there are two primary areas of housing opportunity for persons with HIV. There's what's called facility-based housing, or FBHA, and tenant-based rental assistance, or TBRA. Facility-based housing is effectively the funding of an organization to establish units in a set location wherein people with HIV and their households are able to come in and reside for whatever that duration is. It can be short-term or transitional. It can be long-term permanent housing. This can be done in a number of ways. It can be a single facility. It could be a single room occupancy. It could be units in different buildings that would be called scattered site housing, wherein the relationship between the landlord and the unit is that the unit is actually leased out to the organization that is providing the support and not to the specific individual or household that's moving in, versus tenant-based rental assistance is sort of the opposite. This is support that follows the individual from landlord to landlord as frequently as needed, and that the lease between the landlord is between the landlord and the individual or household that is accessing the units. And the tenant-based rental assistance project sponsor or organization that's providing the service is involved in subsidizing the rent for that individual or household so that they can maintain that unit for as long as they need. Should the individual need to move out of that unit, the tenant-based rental assistance would follow the individual to another unit that they're able to occupy. Supporting these housing opportunities for persons with HIV programming are the following: short-term rental or mortgage utilities assistance, which is needs-based. Effectively, this is short-term funding that goes to households for whom, where there must be at least one individual who is eligible for housing opportunities for persons with HIV, meaning this is a person with HIV. And these go to basically prevent homelessness or prevent them from being kicked out of wherever they're residing. Housing information services, which is largely about helping individuals identify, locate, and acquire housing. And then supportive services, a range of services that can be made available to persons who are accessing and benefiting from these programs to try and support them in maintaining that housing and in achieving their ideal level of health and well-being through connections to other services that are available, be they clinical or non-clinical supportive, or be they just like a housing case management style engagement or any other kind of group or individual level support services for them. Additional activities involved in the housing opportunities for persons with HIV We are going to be asking in this next, well, right now we're actually doing it with existing project sponsors. We're going to be collecting client level data for individuals who are residing in these units, which would be required to be submitted to the Chicago Department of Public Health through a secure file transfer, because it is identifying information specifically of people with HIV. There will be monthly submission of vouchers for reimbursement. This is something that we have to be really tight on. Understanding the reimbursement process for delegate agencies or organizations operating under contract from the city of Chicago is complicated, to say the least, but it is something that we need to be monitoring and supporting our agencies in doing. We have monthly one-on-one support monitoring engagements. We also have monthly meetings with all of the project sponsors. These are considerably less formal. They are optional, but we have found that project sponsors really enjoy having everybody brought together to sort of share what their experiences are in providing these services. There must be participation in site visits and programmatic audits. These are site visits and audits that we conduct, as well as potentially site visits and audits conducted by Housing and Urban Development, which is the federal funder of the Hopwa programming. Annual performance report, including agency-specific information and aggregated service delivery and client demographic and experience data. And of course, at the end of every year, there's a relinquishment of unspent funds, which then go back into a pot of money that we're able to make available to project sponsors and other activities connected to housing opportunities for persons with HIV. And that is the Hopwa presentation, and I thank you very much.